So how often should a patient be monitored for high blood pressure and followed up for blood pressure once they have the diagnosis? If you're a patient that has normal blood pressure, a young, healthy person, 120/80, usually at your annual physical, be it every year or every other year, would be suffice to get your blood pressure checked. Those patients that are in that gamut of pre-hypertension of 120 to 140 or 80 to 90, those patients should probably be monitored definitely at least once a year, if not twice a year. Usually those patients, I try to get them a blood pressure monitor that they can use at home, and then they can alert me if their blood pressure starts to trickle up over 140/90, and then just to follow up with me for a follow-up visit. If patients have known diagnosis of hypertension and they're on medications, then I like to see them, depending on the situation, I'd say at least 3 times a year if they have just straight hypertension and nothing else. If they're well controlled, maybe twice a year. However, most people with hypertension have other problems in addition, such as diabetes. They may have peripheral vascular disease or some kidney dysfunction. Those patients are at high risk for developing complications. So those patients I like to see at least on a quarterly basis, and not just to monitor their blood pressure, but also to monitor their other medical conditions. So depending on where you fall into the gamut of blood pressure and whether or not you have secondary medical conditions, then you would have to talk to your provider about how often you should be followed up. But on average, what I mentioned is what we do in the primary care setting to try to get a patient not only well controlled, but to make sure that they're compliant with their medications, and also to address any issues they may have, such as side effects of the medications. Usually I like to get a baseline lab panel, as I mentioned earlier, and then at least check their blood again every 6 months if they just have hypertension without any other problems. If they have other medical conditions such as diabetes or kidney dysfunction, usually I try to check labs at least minimum of 3 times a year, if not more, depending on whether or not the patient is compliant with their medication, or if they're developing side effects of the medication, or if they're developing progressive complications, and those patients need to be monitored more closely. And at that point, you tend to be a little bit more aggressive in how you draw the frequency of labs. But on average, I'd say a minimum of 2 to 3 times a year to get blood tests.
Medtwice.com